The summer of 2025 in Harlem was overshadowed by a growing sense of unease and fear, even as the sun shone brightly and children played in the streets. Unbeknownst to most residents, Legionella, a deadly and invisible bacterium, was spreading silently through the very water systems that served their homes and businesses. This bacterium, responsible for Legionnaire's disease, thrives in warm, stagnant water, often lurking in water towers, plumbing, and even decorative fountains. It spreads through tiny, contaminated droplets, becoming airborne and infecting those who simply breathe nearby. The outbreak quickly exposed deep vulnerabilities in the city's public health infrastructure, transforming what began as isolated cases into a full-blown crisis that overwhelmed local hospitals and emergency services. In just a matter of weeks, over 100 people fell gravely ill. Many required intensive care, and 7 tragically lost their lives, leaving families devastated and the community in shock. The people of Harlem were gripped by both grief and anger, coming together in vigils and demanding answers. Many questioned how such a preventable disease could be allowed to wreak such havoc in their neighborhood. Symptoms like fever, cough, and shortness of breath often went unrecognized at first, delaying diagnosis and treatment, especially for the elderly and those with weakened immune systems. The outbreak served as a stark reminder that public health is a shared responsibility, requiring vigilance and cooperation from everyone, residents, officials, and health workers alike. It also raised urgent questions about systemic failures, lapses in oversight, and the need for greater accountability from those tasked with protecting the community. Understanding how and why these failures occurred is crucial, not just for Harlem, but for cities everywhere hoping to prevent similar tragedies in the future. The Harlem outbreak stands as a cautionary tale, a story of missed opportunities, systemic flaws, and the urgent need for change to protect our communities from unseen threats. As cases surged, panic and confusion swept through New York City. Hospitals filled with anxious patients, and the city's health system was pushed to its limits. The mysterious illness was spreading rapidly, and no one knew where it would strike next. Health officials raced against time to trace the outbreak's origin, working around the clock. Teams of epidemiologists and public health workers combed through records, interviewed patients, and mapped the spread of the disease, determined to find the source before more lives were lost. Investigators soon focused their attention on the city's cooling towers, suspecting them as the likely source. These massive structures, often overlooked, can harbor dangerous bacteria if not properly maintained. Through meticulous detective work and advanced DNA sequencing, scientists painstakingly analyzed samples from dozens of sites. Their efforts paid off when they identified 2 city-managed locations as the main culprits behind the outbreak. Harlem Hospital and a nearby construction site were directly linked to the spread, sparking public outrage and fear. Residents demanded answers and accountability from city officials. The lack of Legionella testing at the construction site exposed glaring regulatory blind spots, raising questions about oversight and safety in the city's booming construction industry. The irony of a public health lab being implicated as a source of the crisis was undeniable, shaking public trust in the very institutions meant to protect them. The city now faced the uncomfortable truth of internal failures and systemic weaknesses that demanded immediate and sweeping action to prevent future tragedies. This shocking revelation called for a full and transparent accounting of how such negligence could occur and what must change to ensure the safety of all New Yorkers. With the sources identified, officials moved swiftly to contain the threat. They coordinated efforts across multiple agencies to ensure a rapid response. Cooling towers at both sites underwent rigorous cleaning and disinfection. Specialized teams were deployed to handle the complex task. Long-term management plans were mandated to prevent future Legionella growth. These plans included regular inspections and maintenance schedules. The city tightened regulations, increasing testing frequency to every 30 days. This was a significant change aimed at early detection. Stricter rules aimed to foster a culture of compliance and proactive maintenance. Regular training sessions were also introduced. Financial penalties for non-compliance were increased to deter negligence. These fines were substantial enough to encourage adherence. Commissioner Morse emphasized the seriousness of public health responsibilities. He assured the public that the city was committed to their safety. The city's strategy was to fix immediate issues and strengthen future prevention. Investments were made in upgrading infrastructure. Yet questions remained about the sufficiency of these measures. Residents were concerned if these steps would be enough to prevent future outbreaks. Experts criticized the outbreak as a preventable tragedy due to negligence. Chris Boyd highlighted the failure to maintain water systems as the root cause. Harlem Hospital's repeated involvement in outbreaks pointed to oversight failures. A decline in cooling tower inspections coincided with staffing shortages. Despite increased funding, the health department struggled to retain inspectors. This staffing gap weakened the city's ability to enforce regulations. Commissioner Morse acknowledged these challenges but offered no concrete solutions. Critics saw the outbreak as a consequence of systemic neglect. Calls for accountability and reform grew louder. The Harlem outbreak underscored the need for robust public health oversight. Immediate actions were necessary but didn't address deeper systemic issues. The city must ensure agencies are fully staffed and empowered. Solving staffing shortages is crucial for effective inspections. Proactive enforcement and unannounced inspections are vital. Greater accountability is needed, especially for city-managed properties. Independent reviews can ensure transparency and identify failures. The lessons from Harlem highlight the importance of vigilant enforcement. New York City must honor those affected with sustained action to protect public health.